Is that right? Could you
Mhm.
explain more about why we would use ACT, acceptance therapy?
Sure. So I think, so acceptance and commitment therapy, or ACT, is like a very detailed framework, and it's a therapy that someone like myself or other mental health providers use to help people with their suffering. So I'll talk first about the acceptance piece, and then I'll talk about ACT as a therapy as a whole. The way that I like to describe it to people, in terms of acceptance, is when we start getting into, I'm going to live like this forever, this is going to ruin my life, I'm not going to be able to do XYZ, that's not acceptance. That's more catastrophizing, kind of getting in our heads. And maybe, Rupert, you can relate to this. In the beginning, I'm sure you had an idea in your head of all the things that you wouldn't be able to do or what your life might look like. And
Absolutely.
maybe your life looks very different from that now. Maybe there's a lot of things that you are doing that maybe you thought you wouldn't be able to. So getting into the mindset of that catastrophizing is not helpful for us. It creates more anxiety. So the way that I like to kind of marry the mindfulness piece and the acceptance piece is accepting how we feel in this moment only, and continuing to take steps to try to improve our health, because we do know that there are some things potentially that can be done for tinnitus, like addressing any root causes, like if there's vascular issues or head or neck trauma, etc., noise suppression, habituation like sound therapy, and then the mental aspect. So if we can just bring it to this moment and say, I'm only going to accept what I'm experiencing in this moment, it can be somewhat freeing, because then we're not thinking all the way about the future, about what is this going to look like in 15 years for me, because we really don't know what that's going to look like. So that's the acceptance piece. If we want to talk about ACT as a therapy, it's a much more detailed and long answer. I'm happy to go into it if you would like me to.
Yes, please. But
okay.
I would like you to, and it's exactly right what you're saying, because I think for the first 5 years, I was so young and so naive that I got through it with very little help, even from myself. I just was using tape players to create white noise, old-fashioned boogie boxes. I didn't know what was happening. I had no idea, but it was all working. So it was by luck and by experimentation as a musician. But the second time, 10 years later, that I had it really bad again, I was ill-equipped, actually. I realized that I was doing all of the negative things, exactly what you're saying. I was catastrophizing. So I didn't fly, I don't think, or travel properly overseas for about 10 years, because I was so unsure as to what would happen with my hearing. And, it was so difficult traveling. It was enough to be able to just get on trains and boats and all those types of things without then the added pressure of thinking, crikey, if my entire hearing system collapses on a plane, how am I going to pick up the pieces on the other side, and how do I get back, and what happens? And it was just like, it's a nightmare, but it's a really vicious cycle, and I don't have any of those feelings. I really don't. So yeah, a completely different person. I love flying, I love travel. I think what I needed to do was to use the idea of desensitizing. That really helped in terms of sound therapy. So I know that with some sound therapy we use the idea of masking a lot, but that's okay, but that only sorts out one equation. It doesn't sort out everything, and there's lots of different ways to use sound therapy. But for me, it was desensitization, Emily, and very positive thinking, but positive thinking that was relevant to the needs that I was living within. So, for example, I'm not going to think about when I get to the end of that journey. I'm going to try my very best to just enjoy the present moment and deal with that, and try and actually enjoy that. Pick a set of clothes that I'm comfortable with, buy a pair of shoes that make me feel comfortable, like be nice to myself for a change, rather than the idea of this impending doom. It's kind of really simple things though, isn't it? It's really simple. And then when I come back, I'm going to enjoy talking about the experience with a loved one or with friends. And then I share that experience, and then I've moved on from it. And I think it's very, very different. Absolutely right. So please, if it's possible, if you could talk about in detail ACT, please, that'd be lovely.
I will. So I will preface this by saying that this therapy is relatively abstract. I'll try to break it down in an understandable way, but please interrupt me or I'm happy to answer questions on it. So ACT is a mindfulness-based therapy. So if anyone has experience with CBT or cognitive behavioral therapy, you'll know that CBT focuses on us trying to change our thoughts. So we're kind of always wrestling with our thoughts, identifying them, trying to come up with maybe a more positive spin. ACT doesn't have us do any of that. It focuses on changing our relationship with our thoughts and therefore our relationship with our symptoms. So let me offer you an analogy that gives you a kind of an overall sense of what ACT is, and then I'll break down in specific steps. So I want, for anyone listening, I want you to think about, or you can actually do it, putting your hands in front of your eyes. And I'm not going to do it because I want you to be able to hear me. So when you put your hands in front of your eyes, you can't see anything, right? It would be really hard to live your life and try to function if your hands were constantly over your eyes. So the analogy here is that your hands are tinnitus. When you have all of your attention focused on the tinnitus, it completely consumes your life and you're not able to do anything else. ACT has us take those hands, the tinnitus, and put them in our laps. So we're able to see what's going on around us. We're able to engage with the environment. We're still living with the tinnitus. Our hands are still there, but they don't completely consume everything about our experience. Does that make sense?
Absolutely. Yeah, that's
okay.
Great analogy.
Okay. So let me break down. So ACT really focuses on the difference between pain and suffering. And pain is just that. It's kind of the direct experience we have. Say we fall and break our leg. The pain is what's associated with just that, the injury. Suffering is everything we tell ourselves about that broken leg. So let's move that to tinnitus so I can make sure it's more understandable. The pain is the tinnitus. It's the loud noise you might hear. It's just the experience of the sound. The suffering is all the language, all the extra stuff we add on top, saying, I can't handle this. My life is over. I'm not going to ever be able to travel again. I'm not going to be able to live a meaningful life. So ACT outlines 6 things that this therapy believes, or the way that they conceptualize what keeps us suffering, with the idea being that pain is unavoidable in life. Things are going to happen. We're going to lose loved ones. We might experience an illness or an injury or whatever, but suffering doesn't have to be part of our experience. So the 6 areas that ACT talks about that keep us suffering are, number 1, avoiding our experiences. And I think, Rupert, you spoke a little bit to this in the beginning, of all you could focus on were your ears. How do I get rid of this? I need to completely get rid of this. And if I don't completely get rid of it, I can't live a meaningful life. Yeah. So when we're trying to just completely avoid our experiences, it creates a tremendous amount of anxiety and depression. Because we know there is no cure for tinnitus, unfortunately. And so when we're trying to tell ourselves, I need to completely get rid of this, maybe, maybe that's not something that's going to happen. Maybe it can be put in the background and you can experience a very meaningful life otherwise. But when we're focused completely on getting rid of it, it just creates this vicious cycle that we spoke about. Number 2 is living in the past and living in the future. So this is kind of a lack of mindfulness. So living in the past might be grieving our former selves, saying, before this came on, before I experienced this tinnitus, I was able to do whatever I wanted. I had this great life and I took it for granted. And maybe there's some guilt associated with that. Or living in the future. Oh my gosh, what is my life going to look like? And that creates that tremendous amount of anxiety and fear and catastrophizing, rather than living in the present moment, which is what we were talking about, which can really help people just move step by step through the process and figure out their own healing journeys. So that's number 2. Number 3 is lacking direction or lacking a sense of values. So not knowing what's important to us, because when maybe we're stopped in our tracks because we have developed this sudden onset of tinnitus, we're completely consumed by the tinnitus and not thinking, man, I still need to engage in these things that are important to me, like engaging with family or engaging in the arts or engaging in fitness. So we can kind of lose who we are. So maintaining that compass and realizing the things that are important to us, the life we want to live, and taking steps towards still reaching those things is very important. So those are the first three. So let's kind of recap. So avoiding our experiences, living in the past, living in the future, and lacking values. So those are the first three. I know this is long, so we'll get to the last three. We can recap if we need to. Number 4 is being paralyzed by not knowing how to move forward. So instead doing nothing. And avoidance is a major issue for a lot of disorders. Tinnitus, one of them, vestibular disorders, dizziness is a major problem too. The problem is our worlds get smaller and smaller and smaller. Like you said, Rupert, like you wouldn't fly, and maybe traveling was something really important to you.
Yeah.
So it's kind of the idea of just shutting down and not knowing what to do. So we just don't do anything. And by doing that, if you want to go back to the neuroplasticity talk, that's the negative plasticity. It's sitting online and Googling, how am I going to fix my tinnitus, rather than engaging in things in life that are important to us. Number 5 has to do with our identity. So this might be tinnitus completely consuming your identity. So you are your tinnitus. That defines you as a person, rather than seeing, I am a person who experiences tinnitus. I am a person who can observe my tinnitus. I am a whole person with all these other traits and all these other things that define me. And then finally, the last one is called cognitive fusion. It's when we believe that our thoughts are true. So when we're telling ourselves, my life, I'm not going to be able to do the things I want. I'm never going to be able to travel. This is going to ruin my life. I can't handle this. Thoughts are just thoughts. And to me, that's an anxiety brain telling you these things that are probably not true. But a lot of times we get hooked in because these thoughts are very seducing. And we believe that these thoughts are true, and really they're just thoughts. So those are kind of the 6 realms. So if you were to see an acceptance and commitment therapist, this is the framework that they would use to help you move towards engaging in things that are important to you, and to help you kind of get unstuck and just living in service of your values is a term that they like to use. So it's really saying, okay, pain is something that I might be living with, but suffering doesn't have to be. And again, suffering is all that extra stuff that we pile on top of the pain, typically based on language and thoughts and kind of our reaction to situations.